In 2021, we at Health Affairs launched and established the Academic Health Science System Grant. The purpose of this grant is to foster collaboration and integration between UCD, College of Health Science and Agricultural Science, with its clinical partners, including Level 4 major academic teaching hospital, Level 2 and 3 hospitals, the general practitioners, and the community organisations within the regions. This is done because patients do better when treated in an academic health science system or network model. They do better because you practice evidence-based medicine, but furthermore, you recruit and retain better staff and you get added value to the system. We'd encourage all to apply for this grant, in particular clinicians, consultants, junior doctors, research fellows, nursing staff and allied healthcare professionals and UCD researchers. The grants have to be linked together so you foster this collaboration for better care overall.
The title of our project was Developing a Clinical Simulation Education Intervention for Clinical Handover in Our Hospital System. Like all good research ideas, this one came out of a very clear observed clinical need and one that we recognised very quickly could be solved within the context of an academic health system. Within the setting of a big hospital system and a medical school at the heart of it, we saw the opportunity to put together all of the different elements where we could design an educational intervention in the School of Medicine, working with our partners to train up doctors in the very important skill of handing over responsibility for patients as they move through transitions of care. Because we were able to scale up this resource with the funds that we had, we're now in a position to be able to bring it to different hospitals across the health system so that everyone, not just UCD graduates, get the benefit of this training, and therefore all patients within the academic health system get to benefit.
We were successful in achieving the AHSS grant to enable us to do the MatWell study, which was looking at the health and well-being of staff working in maternity settings. This project was between School of Nursing, Midwifery and Health Systems in UCD and the National Maternity Hospital, but looked at the health and well-being, organisational working environment and workload of patient-facing staff in the National Maternity Hospital. It's had a really good impact. It's put forward the health and well-being of staff as a strategic priority within the National Maternity Hospital, and we know that the well-being of staff is a critical indicator of the quality and safety of patient care. There's a relationship between staff well-being and outcomes in relation to the health and well-being of not only staff but also of patients. We used the grant to help us to undertake the data analysis and data collection we needed. We were able to employ a research assistant who we wanted to develop not only to understand the study but also to develop their future in relation to workforce research. So the AHSS grant was a really good, important initiative to allow us to develop not only our research but also staff working with us on the research. The top tip really is having lots of communication with your clinical partner is really important. Being on the ground, meeting with them, listening to their requirements, and co-designing the project as well is really important. Bring your partners in early and use that as a way of moving the project forward and developing really strong proposals.
Think big and be bold. Plan this well, pick something that's deliverable, potentially scalable, that will have a clear impact and that brings people together in that sort of virtuous circle of doing this well and working with people really energizes and motivates people to do more. And that, I think, is really what these grants enable. And I would encourage anyone with a good idea to go and get moving and bring it to life.
We fund 4 of these grants on an annual basis at €30,000 each, and the call is coming up in January of this year. We'd really encourage people to apply for them. We think they're a fantastic grant. They will generate and integrate and establish a better network of care for our patients so they get treated both well in hospital but also in the community. For more details on how to apply, please visit UCD Health Affairs website.